Hypothyroidism. Basically, it is a hypometabolic state, and here the thyroid hormones are decreased in its levels. Now, there are basically two types of hypothyroidism. So, the first one is cretinism. This is the infancy or the childhood form. So, it is seen at birth or in the first 2 years of life. The second one is mixed edema, which is the adulthood form. Now, let's begin with the discussion of cretinism. So, if you see, cretinism makes the child physically and mentally retarded. The etiology of this can be, first thing, there is endemic region where there is decreased iodine levels found in the particular area. The second one can be the fetal is exposed to the anti-thyroid drugs during pregnancy or something. The third one can be genetic defect in any step of the synthesis of the thyroid hormones, like there is absence of any enzyme or abnormality in any enzyme. The fourth one is any developmental anomaly of the thyroid gland itself. Now let's focus on the clinical features. So if you see in these pictures, you can see the face, it has a very peculiar face. So there are widely set eyes, there is a very narrow forehead, the face is round, there is big protuberant tongue, there is broad and flat nose. Other clinical features in cretinism are commonly found in the hypothyroid patients, like there is a bradycardia, there is constipation, there is dry skin, there is less appetite, impaired skeletal growth. This is usually seen in the childhood form, and neurological features like mental deficiency, even these are found in the childhood form. The impaired skeletal growth actually causes dwarfism in the child. Now let's begin with the adulthood form, that is the mixed edema. So in mixed edema, it shows a non-pitting type of edema, and this is due to the accumulation of mucopolysaccharides in the dermis and the other tissues. Let's focus on the etiology of mixed edema. So this can be caused by prolonged administration of anti-thyroid drugs or any thyroid cancer. Then there can be hypothalamo-pituitary lesion, there can be endemic goiter, there can be any form of thyroiditis, or there any surgery or radiation. Clinical features here, as you can see, again there is constipation, bradycardia, there is cold intolerance, there is puffiness of the face, there is loss of hair, slowing of the intellectual function. So in a child, this hypothyroidism affects the CNS way more when compared to the adult form, because during the first 5 years of the child, there is development of the brain yet to happen. So thus this thyroid helps in the development of the brain, and when there is deficiency in that particular hormone, so it causes mental deficiency for life. But in adulthood form, there is just slowing of the intellectual function. There are other clinical features shown, like the muscle weakness, there is weight gain, there is a loss of appetite, menorrhagia. Then as you can see here, there can be puffy eyes, goiter, etc. Now the face of a adulthood form of hypothyroidism. So there is dry hair, coarse, which is coarse and sparse. Then there is lateral part of the eyebrows, they become very thin. There is periorbital edema. Then there is puffy dull face with dry skin. So here, as you can see, the T3 and the T4 levels are usually decreased. Obviously, this is hypothyroidism, and the TSH levels are increased in order to compensate for the decreased T3, T4 levels. So when these levels are decreased, the pituitary gland tries to increase these T3, T4 levels and sends more and more TSH to the thyroid, and thus there can be increase in the size of the thyroid gland.